Indeed.
So,
Now, nowadays, we especially hear a lot of dentists talking about the dental enamel, and we saw recently a toothpaste coming out in the market which fights the thinning of the dental enamel, and they are showing in most of their advertisements that the tooth eventually gets like, a lighter grade at the bottom. It starts thinning down because the enamel starts usually disappearing from the bottom first, and it's a slow and a rapid procedure. Now, these kind of toothpaste which promise to keep your enamel intact, or which promises to actually, which promise eventually that it would thicken your teeth. Do these kind of toothpaste actually work, or these are just, different kind of marketing strategies?
Basically, the cells that form the enamel, after they form the actual bulk of the enamel, they disappear. As for the dentin parts, because you have the tooth, the outer part of the enamel, the inner part of the dentin. And for the root, you have no enamel. You have what's called a cementum, which is weaker than the enamel. That's why the root caries are more rapidly evolved than the enamel. So when a toothpaste promises to save the enamel, basically just oral hygiene. You remove the plaque. That's all you have to do to save the enamel.
Right. And now, talking upon the lines of gingivitis, is it something very common here in Saudi Arabia?
Actually, it's very common in Saudi Arabia.
What are the reasons for it?
But even for, let's talk about the person that's taking good care of his oral hygiene. They usually do the brushing. They're not focusing on the flossing.
Yeah.
Okay, so when you do the brushing, you're cleaning three surfaces, like we said, the top, the front, and the back.
Yeah.
You still have the right and left. You need to floss. If you don't floss, the bacteria is going to look for an environment. They find the environment on the right and left side. They're going to start at the enamel. They're going to go down. They're going to, the plaque is going to accumulate between the teeth. In the long period, it's going to calcify, forming the calculus. And calculus is damaging to the gums or the gingiva. That's why we have inflammation. We have the moderate inflammation, what's called gingivitis. But when it evolves and actual bone loss occurs, it's called periodontitis. And if they're going to become loose and eventually fall out.
Wow. Okay. Dr. Rakan, upon those lines, let me ask you, some of the people, they have like a beautiful set of teeth. That means that they are all compact and very tight and close together, whereas some people have a lot of gaps in between their teeth. So the people even who have the gaps between their teeth, is it mandatory for them to floss their teeth as well?
Actually, they have to, because even when we have the gaps, you still have the gum that's erupting between the teeth, the dental papilla. So that part is covering the tooth. So if you keep that, you're going to have the plaque accumulating there as well. You have to floss.
And how many times should you be flossing? Let's say the minimum number of brushing times should be 2 in a day. What is the minimum number of flossing times?
For flossing, it's usually one time before you go to sleep, because that's when you have the time to do it. But we have to tell the people that flossing is as important as brushing. You have to do the flossing. Yeah.
Right.
and flossing, well, perhaps we should be raising a little bit more awareness on the aspects of flossing, because there are so many people who complain that each time they floss, they bleed. It's because they go so hardwired on their teeth that it actually hurts them. So be gentle. Know that you have gums which are very sensitive. They're way more sensitive than even the skin of your lips. So
No,
just
but
go ahead and
sometimes your
take care.
hand glides down by itself as well when you're
Indeed.
flossing. And
But what I do want to ask you, there are two kinds of flossing tools that I've seen in the market. Now, there is the average flossing thread, which you can just pass through your teeth, or there's also a toothpick which comes with a flossing tool at the end. So it is shaped somewhat like a scalpel, and then in the end, it actually has the flossing
there is
thread.
a third kind, which is like a brush. It's a very thin, very, very thin micro size, let's say straight metallic wire, and it has a very thin brush at the end of it.
Okay, what we usually advise to use is the threaded kind, the conventional kind. The toothpick kind is actually very damaging to the gums, because you're not controlling the pressure you're applying to the gums. So you're pushing it. When you push it, it goes down rapidly. So it will cause trauma to the gums. The threaded part, you have it between your fingers. You have the control over it. The important part is to actually clean the tooth, not the gums. You're moving your way up and down on the tooth surface, not on the gums. That way you'll avoid damage. And when you're removing it, try to remove it as gently as possible.
Right.
And what about the third kind that I was talking about?
The third kind is
thin brush,
usually
which
for
is
the individuals who have fixed partial prosthesis, or we call it bridges, or the implants. Yeah, that way they can clean under it properly to avoid the inflammation. inflammation.
Now, another question coming up, sir, which is not literally about toothaches, but there are often people, like I have seen a number of people over here in the kingdom as well as in the world who have braces. Now, when you have braces, flossing is way outreached because there is the metal which comes in between. So what is the best way that you, as a dental practitioner, would tell us about cleaning your teeth when you have braces on?
Well, you can still do flossing even if you have braces. Like she said, you have the type with a brush on the end of it, but that's not what we use. There's a type that has a little plastic needle thingy. You can place it between the teeth.
Needle?
A plastic needle, not a needle.
Sometimes they have it at the end
needle,
of the toothpick style dental flosses
yes,
as
they
well.
call it the super floss.
Yeah.
Okay, so you place it between the teeth. You can pull it from the other side. You can clean the teeth.
Very scary. Okay, now moving on a little bit more on the treatment of gingivitis. Now, what is the treatment like, and how is it that we should actually be indicated that gingivitis is being formed in our teeth or we are suffering from it?
Okay, basically people know about gingivitis when they start feeling pain or when they start to bleed when they brush. Okay, the treatment for gingivitis, the gingivitis usually caused by the calculus. Calculus is not removed by the toothbrush. Because you leave the plaque for so long on the tooth, it becomes calcified. It becomes very hard. You can't remove it with a brush. You have to go to a dentist or a dental hygienist to do the scaling procedure so that you can remove the calculus. After that, you have to take good measures for the gums itself. You remove the calculus. Now you have to prevent it from forming again and again and again. So that's even if you do that, you have to go every 6 months for the dentist or a dental hygienist to do a routine checkup to see the general health of the gums and the teeth.
Right. Now, Dr. Rakan, how often is it that we could see dental complications when we look into the mirror?
Into the mirror?
Yeah.
Well, usually people see the complication on the outer side. That's it. Some people actually try to open and look inside, but like I said, it's a very tiny pit. You won't be able to see it. Even we dentists, we see it as a dot. When you open the tooth, we see it very deep. In the X-rays, you can see it sometimes you don't.
All right.
The X-rays is usually used for the caries between the tooth, not the upper part. Because caries come from any part of the tooth.
Now, Dr. Rakan, nowadays we get to see people having the veneers and different kinds of fancy gadgets that they are getting for their teeth. Now, how is it that people could possibly take care of teeth once they have veneers? Is it healthy for people to be actually having the dental veneers or those kind of different procedures, Invisalign as people do?
Invisalign is another topic because it's an orthodontic treatment. Some people have to have it.
Yeah.
But for the veneers, it's kind of like a plastic surgery. You don't have to have it, but people like to have it.
Yeah.
When you have the veneers,
Most of the people actually nowadays. With
no,
so
actually,
much
some people actually need veneers because there's a condition called fluorosis. An increased intake of fluoride from the water or the toothpaste itself can cause brownish discoloration on the tooth. It never goes away, so you have to cover it with a veneer. That's a treatment, but for aesthetic effect, okay, you can have the veneer, but you have to take good care of it hygienically with the brush or the floss, and avoid having forces on it because it's very weak.
And sir, these days, since there is so much of awareness when it comes to our health and even our dental care, there's also another thing which is known as acid erosion. And it has been in the market for over 2 years now. And you see the enamel getting thinner and thinner
Yeah,
as
that's what I was talking about. Yeah.
yeah. So acid erosion, is it a common thing among teeth? Is it a unhealthy way? Like your teeth hygiene is not healthy enough and that is the reason acid erosion is taking place? What is the real root and the cause of acid erosion?
Because of the main cause of acid erosion is the diet. If you drink too much soda drinks, or actually the people that put lemon between their teeth, I don't know why, they usually do that.
Yeah.
Yeah, the acidity causes erosion.
Or they say sometimes apples also could do that.
They can do that if
Yeah.
you keep them in the tooth for a long time. But usually the common thing in Saudi Arabia, the soda drinks. And
Soda drinks.
other countries, the alcohol can cause
Okay,
that,
let's
but here
say
we don't have that.
if we take the soda drink with a straw where it's not really having as much interaction with your teeth. I mean, obviously, when we gulp down soda directly from a can, we have it like all inside the mouth. Whereas when we take it with a
The
straw,
straw, okay. It goes to the esophagus directly, but some people actually, I don't know, keep it in the mouth for some reason. There's
So
a
you
lot
They
of
like to
habits.
feel the bubbles
Yeah,
in
they
their
like to be
mouth.
the bubbles. They have a lot of habits when drinking soda. So
True. Okay. So we have learned one thing from our dental surgeons, general practitioners, and the doctors as well, that soda drinks are just bad for all the valid reasons. So just avoiding soda drinks on the whole is going to be a greater idea. But thank you very much, Dr. Rakan Shaheen, for
thank you
joining
for
us.
having me. Thank you
It
very
was
much.
an overall great experience learning more about the
Oh,
dental
very
hygiene.
quickly, Dr. Khan, what is it, how is it that you would assess our smiles?
The smiles. Well,
How does it
seriously.
look from on the surface? Some
Yeah,
complications going in
perhaps
there?
on a scale of 1 to 10. You
Oh,
better not give her better marks.
no, the teeth are good. The gums are not.
Oh, okay.
For
So,
both
well,
of you. Yeah.
that we all have to be getting more careful about it. And very briefly, Dr. Rakan, I would ask you also another thing. That is, if somebody comes to your clinic, let's say for a regular checkup, how much is the likelihood of them getting hooked up? That means that they would need a long follow-up after that. They would have a list of treatments that they would need to go through, because some of the people eventually are actually even scared of that.
If it's the first time he's gonna visit the dentist, is taking a gamble. It's either his teeth is gonna have a slight decay, or it's very severe decay. So that's why we encourage people to have a routine checkup. We have a saying that early detection improves prevention.
Indeed.
Yeah.
It
Certainly.
definitely does. And well, with this, it definitely is a wrap. No more questions popping from Sama Aziz or Neha Aziz. Thank you very much, Dr.
Thank you
Rakan
very
Shaheen,
much.
for joining us. It really was an informative way. And perhaps those of us who are a little bit like myself, who are scared of going to the dental surgeons or the dental departments or the dental clinics, perhaps we should try to buck up and just go ahead to see whatever we could do to improve the health of our dental hygiene. However, for the moment, we're going towards a break, towards a new segment, after which we're going to be coming back and producing more awareness amongst our society and our community. So stay tuned to Good Morning KSA.